That healthy habit you do every single morning, the one your dentist told you to do, is silently raising your blood pressure. And I don't mean by a little. I mean by enough to increase your stroke risk by double digits. Now, I'm going to show you the proof. I'm going to name the exact product, and I'm going to give you a safer replacement you can start using tonight. But here's why you cannot skip ahead. If you don't understand the 4 mechanical failures happening inside your blood vessels right now, nothing I tell you will stick. Your body has a specific, fixable problem, and in the next few minutes, I'm going to decode it for you. Hi, I'm Dr. Sarah. Welcome to the Senior Health Podcast. If you're new here, I'm a geriatric specialist, and this podcast is my way of fighting for you because I believe your pain has been ignored for far too long. I want to tell you about someone. His name was Walter. Walter was a 71-year-old retired postal worker. 43 years carrying mail through Chicago winters. Rain, snow, didn't matter. The toughest man I ever knew. But when his blood pressure hit 185/110, Walter changed. He stopped driving his grandkids to soccer practice because he was terrified he'd black out behind the wheel. He stopped tending his garden. The one thing that kept him going after his wife Dorothy passed. He told me once, and I'll never forget this. He said, "Doc, I'd rather go quick than end up in a chair with my daughter spoon-feeding me." That sentence broke me because Walter wasn't dying. Walter's body was sending him a distress signal, and nobody was listening. But then I found something. 4 specific things, actually. And when Walter started doing them, everything changed. I'm going to share exactly what I showed him with you right now. Before I show you the solution, I need you to understand why this is happening inside your body. And here's what honestly frustrates me. Most doctors will look at you, a patient in real pain, and say, "Well, you're 70, what do you expect?" That is lazy medicine. That is an excuse. This is not you getting older. Your body is sending you a very specific distress signal, and I'm about to decode it for you. Here's what's really going on. Every blood vessel in your body, all 60,000 miles of them, is lined with a paper-thin coating called the endothelium. Think of it as Teflon inside your plumbing. When you were young, that coating did 3 things. It kept blood flowing smoothly, it kept your vessels flexible, and it released a protective gas called nitric oxide that prevented clogs and rust. But over time, not because of aging, but because of oxidative stress, inflammation, and sugar molecules called ages, that Teflon coating gets damaged. The factory that makes nitric oxide starts malfunctioning, and instead of producing the gas that keeps your vessels soft, it starts producing a molecule that damages them even further. Have you ever seen an old garden hose that's been left out in the sun for years? It gets stiff. It cracks. It can't flex anymore. And when you turn on the water, every pulse slams through because the hose can't absorb the pressure. That's what's happening to your arteries. The flexible spring is gone. And here's the part nobody tells you. Your body has a pressure gauge, a thermostat, called the baroreflex. When your arteries get stiff, that thermostat resets. It starts treating dangerously high pressure as normal, so your body stops trying to fix it. But here's the good news. Every single one of these failures is reversible. A massive study published in the British Journal of Sports Medicine looked at 270 randomized trials, over 15,000 people. And they found that one simple exercise, something you can do seated in a chair with a stress ball, reduced systolic blood pressure by 8.24 millimeters of mercury. I want you to hear that number again. 8.24 millimeters from squeezing a stress ball. Not surgery, not another pill. That is comparable to a first-line blood pressure medication. The researchers ranked it the #1 most effective exercise type for lowering blood pressure. Above jogging, above weight training, above everything. All right, here is your morning protocol. 3 exercises, all done seated, all under 10 minutes total, and every single one is backed by peer-reviewed research. Grab a soft stress ball or just roll up a bath towel. Sit comfortably in your chair with your feet flat on the floor. Now squeeze at about 30% of your maximum strength. Not a death grip. Think firm handshake. Hold that squeeze for 30 seconds. Then release. Switch hands, rest 30 seconds. Do 2 rounds on each hand. Here is exactly what you will feel inside your body. After the second set, you'll notice a warm flush spreading through your forearms and into your fingers. That warmth is blood vessels responding. They're learning to relax. That is your endothelium waking back up. One rule, and this is critical. Never hold your breath while squeezing. That's called a Valsalva maneuver, and it can spike your blood pressure dangerously. Breathe normally the entire time. If you have severe arthritis, use a softer ball or the rolled towel. Same benefit, less strain. This next one is so simple, it almost feels like cheating. Sit with your back supported. Place one hand on your chest and one on your belly. Now breathe in through your nose for 5 seconds. Watch your belly rise while your chest stays perfectly still. Then breathe out through pursed lips for 5 seconds. That's 6 breaths per minute. That exact rate has been shown to reset your baroreflex, that stuck thermostat I told you about. The American Heart Association gave this a Class 2A recommendation. That means they consider it a legitimate treatment for blood pressure. Start with 5 minutes, work up to 15. You will feel a wave of calm settle through your chest within the first 2 minutes. That is your nervous system shifting from fight or flight to rest and repair. If you feel lightheaded, slow down. You're breathing too deeply. And if you have COPD or emphysema, check with your doctor first. Still in your chair, slowly straighten one leg out in front of you. Tighten your thigh muscle. Hold it for 15 seconds while breathing normally. Lower it slowly. Switch legs. 2 to 3 rounds on each side. If straightening your leg hurts your knee, here's your workaround. Keep both feet flat on the floor. Simply press the back of your knee downward into the chair seat while tightening the thigh. No leg lifting required. Same muscle activation, same benefit. Now this part Walter loved. Every morning, 1 cup, 250 milliliters, that's about 8.5 ounces, of beetroot juice. A study in Hypertension Journal gave this to 68 patients with high blood pressure for 4 weeks. The result? Systolic pressure dropped by 7.7 millimeters of mercury. Your urine might turn pink. That's completely harmless. It's called bituria. Don't panic. Mix it 50-50 with apple juice if the taste is too earthy. Add a squeeze of lemon and a pinch of ginger. Now, drug interactions. If you're taking ACE inhibitors, ARBs, or calcium channel blockers, the blood pressure effect adds up. Monitor your levels. And this is important. If you take sildenafil, that's Viagra, do not combine it with beetroot juice without your doctor's approval. Both work on the same nitric oxide pathway, and together they can drop your pressure too far, too fast. Now, this next part is my favorite. These are the exercises you'll do tonight, right in your bed, right before you close your eyes. They're gentle, they're calming, and they will work while you sleep. Lying in bed, breathe in through your nose for a count of 4. Hold for 7. Exhale slowly through pursed lips for 8. That's 1 cycle. Do 3 to 4 cycles. Takes about 80 seconds total. The ratio matters more than the speed. If counting to 7 feels too long at first, count faster. You'll naturally slow down over a few nights. Cleveland Clinic specifically recommends this for lowering heart rate and blood pressure before sleep. If you have COPD, skip the breath hold entirely. Use box breathing instead. 4 counts in, 4 counts hold, 4 counts out, 4 counts hold. This next one takes 2 minutes, just 3 zones: hands, shoulders, feet. Make gentle fists for 5 seconds. Then let them fall completely open for 15. Shrug your shoulders up toward your ears for 5 seconds. Then drop them. Curl your toes for 5 seconds. Release. Use about half your strength. Never strain. Studies in older adults with hypertension show this can drop systolic pressure by 10 to 30 points in the moment. Skip the toe curls if you have neuropathy or gout. Still lying down. Point your toes away from you. Hold 2 seconds. Pull them back toward you. Hold 2 seconds. Repeat 10 to 15 times per foot. Then 5 slow circles clockwise. 5 counterclockwise. This is one of the safest exercises in all of clinical medicine. Hospitals prescribe it to bedridden patients after surgery. It pushes pooled blood back toward your heart and reduces swelling. And it takes about 2 minutes. Now, knowing Walter, I know exactly what some of you are thinking right now. What if I'm already on 2 or 3 blood pressure medications? Good, keep taking them. Everything I just showed you works alongside your medication, not against it. In fact, the hand grip study specifically included people already on blood pressure drugs. But always tell your prescribing doctor what you're adding so they can monitor you. What if I have terrible arthritis in my hands? Use a softer ball, or skip the ball entirely and press your palms together in front of your chest. Same isometric principle, 0 grip required. The breathing exercises need no hands at all. What if I'm over 80? Is it too late? Absolutely not. Your endothelium can start producing more nitric oxide within hours of your first breathing session. Your arteries can begin softening within weeks. The DASH diet trial showed results starting in just 14 days, and there was no age cutoff. And I want to be completely transparent with you right now. I am a doctor, but I am not your doctor in this video. These remedies are powerful. I've seen them work on Walter and on hundreds of patients, but they do not replace your personal medical care. Please, always talk to your physician before starting anything new. And whatever you do, never stop your medication suddenly without your doctor's guidance. Okay, before I let you go, there is one thing I desperately need to warn you about. This is the mistake that will undo everything I just taught you. And I promise you, almost every single person watching this right now is making this mistake. Every single day. Your mouthwash, that antibacterial mouthwash sitting in your bathroom right now, is raising your blood pressure. Here's why. Remember that nitric oxide, the gas that keeps your vessels flexible? Your body has a backup factory for making it. Beneficial bacteria living on your tongue take the nitrate from foods like beets and spinach and convert it into nitrite, which becomes nitric oxide in your blood. It's a rescue system, especially critical when your primary factory is already struggling. Antibacterial mouthwash destroys those bacteria. A study from Queen Mary University of London found that just 1 week of using chlorhexidine mouthwash wiped out 90% of that conversion. Systolic blood pressure rose 2 to 3.5 points, and a Harvard study following 540 people for 3 years found that those using mouthwash twice a day had a 117% higher risk of developing hypertension. 117% from mouthwash. But it gets worse. Researchers at the University of Plymouth found that when people exercised and then used antibacterial mouthwash, the mouthwash canceled 60% of the blood pressure benefit from that exercise. You do the work, and your Listerine erases it. The fix is simple. Switch to a fluoride-only rinse, no antibacterial agents. Or use a saltwater rinse. Or just brush and floss well. Your dentist will understand. Your blood vessels will thank you. So remember, squeeze a stress ball for 4 minutes each morning, breathe at 6 breaths per minute, and throw out that antibacterial mouthwash tonight. Start there. Your body will thank you by morning. Now, if you want to protect your heart and keep your circulation strong for years to come, you need to watch what I prepared for you right here on your screen. I'll see you there.